All right, welcome everybody. We'll go ahead and get started here. Welcome to Insights. Thanks for joining. My name is Dan Holleran, over the Next Gen Vertical at Cork. And this week's presentation is on current and emerging technologies supporting patient-centered care. I'll go through my standard disclaimer that nothing we're sharing here on this presentation is intended to be legally binding or prescriptive advice, and this entire presentation is the knowledge of publicly available information and best practices that are out there. Fantastic. All right, so we're talking about technology and patient-centered care. What that means, and I mean, you could take that concept in a lot of different directions. We did this presentation last week at the Midwest St. Louis MGMA PACS conference, and that went very well, or it's a version of this. So if that's been distributed, you may have seen this, but it's a version of that, slightly modified. And so it's focused more, as you'll see, on this concept of the Office of National, the ONC put out a statement that said, you know, in 6 years, your average person will be able to actively manage their own health care through the use of information and technology. And so that's kind of what we wanted to discuss today. This concept, you'll see, you know, person instead of patient, that's sort of sweeping. That's more popular phrase these days. What they're talking about there is what people are referring to as the last 3 feet. So as someone gets admitted to you know, a hospital, or if you just have, pure and simply, a follow-up at your, you know, ambulatory doctor's office setting, when you leave there, the provider, you know, in old school mentality, loses touch with you. You know, if you know, they can't get a hold of you unless they actually pick up a phone and call, that's about the extent of their ability to keep up, you know, up to date with someone. And as the industry changes with how physicians are reimbursed in their payment models, that risk is being translated onto the provider to actually know, you know, how the patient's doing outside of the provider's office. So not when they're a patient, but when they're a person, and that's what that means, person versus patient. So that bottom bullet point there is actually pulled straight from a white paper that the ONC released. Let you read that. Okay, so you know, what does that mean? Visually speaking, here's a little Venn diagram. This is sort of the future of healthcare and the interaction and what is needed today. Today, those circles are very much separated out. So the healthcare side, the blue side there on the right hand is that whole area of when you go to the provider, you go to a doctor, you get your plan and your instructions, and you know what you're doing, and then you leave, and that's when you go home, and that's the wellness side in red on the left. And that's where you have to have this whole concept of self-management, prevention of all of these things, all these diseases, and how you exercise and your nutrition and everything that we call wellness. They don't overlap, and the goal is that interaction piece, that middle piece, is sort of combined to where there is a healthy bidirectional flow of data and provider and patient interaction, so that you know, person-centered management can effectively exist. So that's the goal. There it is. And so I'm not going to read this entire slide to you guys, but essentially these are the ONC's core values, again, ripped right from the white paper there, about your average patient and needing to participate in their own managed care across their different wellness services that they get, and it being sort of a joint effort, a partnership between the caregiver and the actual patient themselves. And that all that data itself is very important, and we got to make sure and aggregate all that and use it on the healthcare IT side. So let you guys read those slides. So the main question here, why do we care? And, you know, great question. I don't know how many folks were at the HIMSS conference that was in Orlando this year. Hillary Clinton was the keynote speaker, I believe, and said that quote right there. We will replace the fee-for-service model that exists today and replace it with the whole concept of quality, value over volume. And this should not be a new concept to anyone, but if you can believe that, if you have to go to providers today, and that's a real thing that exists today, is fee-for-service. I mean, it does. It exists every day. And there are starting to be models that replace it, but it's still a large majority of provider reimbursement models that exist still are. And so, you get Hillary Clinton up there talking to all these providers that are out there telling them this is coming. That's a pretty big statement, and it's the truth. And then obviously the second bullet point. I don't know if anybody's ever listened to Newt Gingrich speak. He's very verbose and says something similar to Hillary. I'll let you guys read that. I'm not going to read it to you, but very, very similar structure, very similar concept that he's mentioning there. Value-based reimbursement. And so the move and the progression towards that is actually occurring today. The value-based payment modifier it exists today. It used to be only for larger groups with 100 or more docs, and now it's 10 or more, and it's going to keep shrinking even into next year. And then they're going to publish all this data, and that stuff exists today. That physician compare website actually does exist today. It doesn't have as much information as we would like it. It will grow. I think if you go out there right now, it's got whether or not the provider is actually a meaningful use participant, and if they e-prescribe, I think are the two things that are out there right now. But the plan is to grow that that amount of data that's out there for each doc quite a bit. So you can get the concept here is this whole person-centered care goal is directly related to physician reimbursement when you talk about the concept of value. Because if you have to take care of the person while they're at their house, then you're going to need technology to be able to do so. And that is, so the technology that exists today, we're going to talk about what exists on the healthcare side, and we're going to talk about what exists on the wellness side. But first, I myself, I did a small little baby case study on myself here. One slide is all. From a person perspective, some people actually are living this model today. I'm one example, and essentially what happens with me actually is about a year and a half, 2 years ago, I got type 1 diabetes, and I have no family history of it whatsoever. Just one of those things that happened, autoimmune, came and got me. And so, I myself went out and I used to have a different pump called Animus, but my insurance changed and I had to go with Medtronic, which is a whole other conversation and insight topic on transparency that we did a while back. That's still a very real topic, and I'm living that. But anyway, so I use Medtronic for, insulin pumps and continuous glucose monitor, so I always know what my blood sugar is. And then I have a little CareLink wireless transmitter that I plug into I've got two. I've got one at my home, and I've got one at the office. And anytime my sensor reads my blood, it wirelessly communicates with my CareLink USB, and it uploads it to you have to register, but it uploads it to your provider's website, and they can review that, and they do. And I've got a Follow My Health mobile app that I utilize that is on my iPhone. And so, I mean, trust me, I'm not an early adopter by any means. I've got an iPhone 5. I'm sure there's folks on this call that have an iPhone 6 and the iWatch. And we'll talk about emerging technology here in a minute, but essentially, the app, they can get on there, look at my results, and then ping me. And they can say, hey, Dan, doing a good job. Hey, Dan, you're not doing a good job. You need to do this and you do that. In as often as they want to communicate. That's in that purple area, the Venn diagram we were talking about earlier. That's that bidirectional communication that occurs with me today. And so it pops up on my phone just like anything else. I read it. It's not like I ignore it. If you've got apps on your phone today that have little red indicators, what do? You have to clear those out. You have to, I mean, they beg to be read. And so I use it, and it works great. You know, I'm well controlled. I'll probably never have a true complication. My A1C levels are through the floor. So it works out very well. And, you know, the emerging technology that's coming is, I mean, you've probably all read white papers on it, but it's actually real. Like, Google's got a contact lens or something that's supposed to read your blood glucose values. I mean, I think that's kind of cool. You know, a lot of people think that it's the EHR vendors that are on the cutting edge of some of that technology, and really it isn't. It's the Fitbits of the world and the companies that create the little healthcare wearable apps. I mean, those are the ones that are taking over and leading all that emerging technology. So anyway, you know, that's just sort of, you know, a case study looking at my own situation. There's obviously many different permutations and situations that are out there, but the ONC says that, you know, I'm not really supposed, you know, they say on average, you know, this sort of interaction, it'll take 6 years for your average patient to begin participating in it, and I think it'll happen a lot sooner than that. I know it is for me. It's happening right now. So let's, you know, now we're talking about the healthcare technology side of the world. You know, WellPoint today already provides its senior patients with, you know, in-home monitoring equipment for, you know, the blood sensors, for the glucometers for the diabetes, and they have, you know, the cuffs for hypertension and scales for CHF, and that's that interactive reaching across the circle there. Things that are going on. And so, you know, continuing with healthcare technology, what else is out there? And so, trust me, I mean, we've only got so long on this presentation. There's a lot of emerging technology out there, but I'm going to keep it high level. I'm going to keep it broad so that it makes the most sense for all. But so obviously with to participate in this exchange process, there's patient portals and meaningful use and all the reforms things that are out there. The MU2 requirements require that a portal is used to message the doctor. So that's good. I mean, if you look at as long as the ends justify the means, of course, there's a lot of arguments for them. But they, you know, portals are starting to become absolutely more and more common with organizations around the country. That whole shared risk model. I mean, if you think about it, one way to reduce the risk on your side is to put it on the others, and that's what's happening here. These providers are, they've got additional responsibility to make sure that they communicate with the patient while they are a person at home. And all the while that, again, healthcare technology, these HIEs that are out there, and they're consuming data like crazy and identifying trends, of course, and that is, you know, the definition of big data. And with all the reform stuff, there's, you know, the CDA requirement for transitions into care, which is that I think it's clinical document architecture, I believe, and that's more of just a term for how you transmit what format like the XML file standard that is the continuity of care document that gets translated back and forth. That's what that CDA is. And then, of course, SNOMED codes. So if anybody's obviously involved in meaningful use, at one point or another in a 2014 version, SNOMED codes have been around now. And for anybody that doesn't know, the goal here with SNOMED codes obviously is to bring a little uniformity across systems with uniformity in detail. So, you know, if you thought ICD-10 was going to be challenging, that's nothing compared to SNOMED codes. And don't get me wrong, I mean, EHR vendors are providing like mapping tools and things like that to help you compare I mean, it used to be a doctor would throw an ICD-9 code in a chart and call it a day. And, you know, SNOMED codes, you know, now when we're introducing this, now we're trying to get more detailed. So, I mean, I don't know, there's 19 levels of hierarchy with a SNOMED code, and Now we're talking about onset dates, and we're talking about just getting to a very granular level of detail with that SNOMED code, and that actual numeric code associated with it will be unique across all these different systems, and they'll be able to sort of report trend and gather that data across systems, and it'll greatly improve the accuracy in which care is distributed and how we understand patients. Great. So, okay, so that's healthcare technology. Let's talk about wellness. We're talking about the other side. We're talking about the red side of the Venn diagram from up above. What's out there today? Wellness technology. And again, it's a broad concept, so bear with me here. We're talking about what's out there, what people are using, and the Fitbits of the world, the little wristbands, the Nike Fuel Band. There's all types of calorie counters out there that are collecting data 24/7, and these, as long as you're wearing them. And then the MyFitnessPal, you guys, I don't know if anybody's ever used the MyFitnessPal app. If anybody's ever been on a diet and wanted to count calories and scan barcodes, this thing's great for that. It does a lot of other things besides that. However, that's one of the biggest ones that people use. These are sort of the types of things we're talking about with wellness technology. So people are using this stuff every day to try to keep themselves healthy, lose weight. How fast is my heartbeat going? Things like that. That's what's out there today. And then on the wellness side, believe it or not, nutritional literacy is starting to become, it's prevalent in certain areas, and it's starting to become more and more prevalent in other areas. The concepts of, going to your favorite restaurant and seeing the actual calorie count right there on the menu, or having logos that represent local healthy initiatives, things like that are what that's talking about. And obviously smoking bans and all of the menu items at restaurants that say, okay, these are our low-cal options, or these are our gluten-free options, or, I mean, those things are almost, everywhere I go in the Midwest anyway. So it's, that nutritional literacy, believe it or not, is starting to make its way out there, and so that's good for a lot of people who just don't think twice and just start, choosing off the menu. Okay, so that's, again, if you remember the diagram from up top, is, what we're talking about here is how do we, there's this gap in between them, and how do we pull them together is the goal. And then, of course, someone's got to make a decision based on it, but they can't even do it unless you have the data. So you've got all these portals and data aggregators on the healthcare side, and you've got all this wellness technology and nutritional literacy on the wellness side. What do you do? So we've got this concept of HIE integration and wellness data into a clinical visit, and how can that occur? And then you've got, at the same time, in the back of everyone's mind, you've got this whole pay-per-value concept where the whole idea behind this is to reduce the number of visits that a patient has to the doctor's office, or the ER for that matter, and a reimbursement model to support that. I mean, there's got to be some kind of monetary incentive where we're all getting these shared savings by reducing that visit. So we need to basically combine that bidirectional data and also, make more money in the process, or something similar depending on what hat you're wearing. And who's doing it today? So the closest solution out there, Apple Health. And, they're still in the development phases, but they're doing a pretty strong push right now to bring all of that wellness data into the healthcare world, and then continuously providing solutions to the person or the patient at the person level when they go home, and integrate that stuff back into the chart, although, of course, it doesn't have a track record yet, so obviously the uptake and efficacy remain to be seen on that particular solution. So one thing that we're doing at Quirk is we have this Savannah Innovation Center, I don't know if anyone's heard of this yet, but it's out of Savannah, Georgia, and we're essentially now practicing what we preach, if you will, in an old medical building, actually in downtown Savannah, in the historic district. So in the 1800s, this building itself, this is an artist rendering, it actually exists. The outside of it is built. I need to send a more recent photo. It was declared that if you had a ship that had over 10 sailors on it, you had to provide them some level of coordinated care at these different hospitals along the coasts. And so these were spun up at the time by the government, and it was almost like a makeshift version of Obamacare today. But they had it so long ago, and it was actually kind of funny. We learned that after we chose the location, so it was just kind of funny that it ended up that way. I'll talk more about that in a minute. So what's going on with this wellness center? It's actually chosen specific. I mean, if you look at this health crisis that is occurring in Savannah, and I don't have Savannah specific numbers on here, obviously, but this is diabetes, cardiovascular disease, and obesity are very high in that neck of the woods. This is what's called, and especially there in the heart of the stroke belt, if you will. And so that is a very high risk area. And so if there was ever a place for a wellness center, we've touched down in the correct place. And so the goal of this, what's going to be occurring here, is a patient-centered medical home, of course, with emphasis on these 7 areas that exist here that are designed to basically treat the patient at every aspect and follow sort of some guidelines. And those guidelines are on this slide here. So these 4 components of wellness, as we're calling them, are the guiding these 4 principles here that will make up this model are, of course, number 1, medicine. And so, as needed, obviously, if our patients need it, we can use the latest and greatest medicine that exists. But obviously, on the wellness side, we're going to go and make a big push that doesn't exist today on, of course, fitness. So we will employ, providers that can prescribe activity. And then follow through on it. There will, of course, be one really cool thing is there's a big giant park that is off one corner of the building, and there's always events out there and people exercising and things like that. So it kind of ended up nice that this was bordering that park, and so kind of goes right along into the fitness piece of this. And then nutrition, we'll have a cafe there, and we'll have cooking classes, and it'll all be centered, obviously, around healthy food. I mean, if you walk down the streets of Savannah, it's really big into just Southern cooking with, no emphasis on what's actually being put in your body. I mean, you have no idea the cooking content. It's not on the healthy side of the street, and then there's still a lot of smoking in Savannah, and so obviously we'll counsel against that. But I think it's a very high number. 1 in 4 people smoke, I think. I saw a stat at one point or another. And then the social aspect of it. So believe it or not, social interaction, and it translates very directly into wellness. So, creating groups and getting patients that need it integrated into these social settings and seeing how that creates a positive experience for them is exactly what we're going for. All right. And so as this thing is slated to launch in March of 2015. The building is literally under construction right now, but this whole model is designed to be definitely a shared savings model for all of the employer and the plan and the provider are basically going to. We're walking down and looking through the employers of Savannah, and we're partnering with them on all of their subscription models that the employer will cover, and there'll be some employer-employee shared savings there. And then obviously the plans that we've been talking to, we're still in talks with them on how to create this model, but it'll be a funding model that is very much an accountable care shared savings model. Okay, so how are we doing this? The underpinnings, if you will. So on the technology side at the Wellness Center is what we're speaking about here. So we're choosing next-gen EHR for our clinic's health record, and it's mostly because NextGen is open, as it were. We have access to install engines, and we can run reports right out of their SQL database if you get access. So it's not as locked down. It doesn't have as handcuffing as some other systems that are out there, and that's why we've chosen it. NetPulse for wellness integration. Some of those technologies that I showed on a few slides ago, Fitbit and Nike Fuel Band, things like that. This technology, NetPulse, actually has all of that data, and they mine it for us, and it's a low monthly fee. And so we simply, they will give us that fire hose, that pipeline, if you will, of data. We'll be able to pull that into a local database on the server, and then basically from that point we can integrate it into the EHR and show it alongside any other data. And the way that's done is obviously going to be done carefully. There's still plenty of conversations about providers, and I don't they don't care about how many steps you took yesterday if you are in there for a dermatology visit. So there's, it's certainly going to be, we will then have the full control and capability to pick and choose, from a clinical director standpoint, the types of data that we get. But the point is we use NetPulse for that. And then we use Mirth. Mirth obviously is an open source interface engine. NextGen actually bought Mirth, I think it was last year. And they left it open. You can still go download Mirth Connect today on the website, Mirth's website. And it's very, very flexible interface tool that is used to, you can hook it up to a database, which is what we will do, but you could also do file-based drops, and you can import, export in any format that you need it to be in. And any transport protocol. So if it's streaming port to port, or if it's a file-based move or anything like that, web-based, it's got all the connections on both sides. So it's kind of easy to work with, and a lot of people know Mirth these days. So as we start to expand out and connect with other HIEs and things like that, Mirth is actually at the forefront. Mirth's HIE product that I think is purchasable. I think they run several of the current state HIEs for the U.S., so they're no strangers. Anyway, that's the technology we chose for those reasons, and we'll see how that goes. Okay, so where we will be in 2020. So this is more designed to be, if we had a crystal ball that we had to look into it, the ONC says in 6 years or in 2020, we will be able to, a person-managed care type environment, bidirectional flow with the provider. Where they want us to be is right here. So obviously self-management, like I mentioned, full interactivity between the healthcare provider and the person. Obviously, I just talked about the shared models that exist, the pay-per-value, and the cross-cutting, which is the purple area of the Venn diagram that was earlier on, where there's the barrier that exists between healthcare and wellness today. That's where they want us to be. So, the rest of the story, this slide basically means this is our prediction. So the groups that are out there today, and of course, you know, it's almost impossible to predict something 6 years out. It's hard to predict out past a year these days with reform changing on a dime. But groups like Apple Health will make wellness fashionable. The social aspect of that will take over. If you've ever got, you know, friends that are all, you know, you've probably seen commercials today on the iPhone, and friends in competition about their health data, and as apps start to become more integratable, that stuff, you know, everybody wants to check in and tell where they are. It's like people will be checking in on how much weight they've lost or how much, I mean, that kind of thing exists today. But that whole fashionable concept, a company like Apple Health or someone similar will go ahead and do just exactly that. And then the concept of this reimbursement model and this whole person-centered care will, of course, be here. I mean, in 6 years, I mean, think about it. So the whole fee-for-service model that exists today is going to be replaced by the value concept. And if you think about it, physicians, you know, who don't make the cut, that are getting these, you know, the quality scores are low for them, organizations could eventually start dropping them. It's like, if you don't get your value up, I mean, you're not making us money. Like, we can't make any money. You know, they might even be removed from the networks in general. So there's going to be this shift that'll occur to that direction. It'll be real interesting to see how providers react to that. So with that, I'll open it up if anybody has any questions at all. And here is some email address, contact info, if you don't have any. All right, guys. Well, I appreciate everyone's time. We'll put this up there on the web and send the link out, and I appreciate everyone joining today. Thanks so much. Have a good one. Bye.